In recent years, the state has cut over $113 million in mental health services. During the same time, we saw the closure of a local mental health center, a decrease in services provided by mental health agencies, and an increase in committals. The Orland Park Police Department recognizes the need for assistance in addressing the increasing mental health crises. A crisis intervention team was formed and formally trained to respond to calls involving mental health-related circumstances. The Orland Park Police Department and Trinity Services, in collaboration with DePaul University, applied for and received a mental health collaboration grant from the United States Department of Justice. As a result, the Orland Park Police Department is pleased to announce its Mobile Crisis Response Unit partnership with Trinity Services. The partnership allows for real-time, thorough, and in-depth assistance for those in need when they need it most. A typical scenario begins with a call for assistance for a person experiencing a suspected mental health-related concern. The dispatcher is trained to gather all necessary information to allow for immediate and appropriate assistance for the person in need. The caller, in this case, is a coworker who has concern about the mental well-being of a fellow employee who has expressed the desire to harm himself. The dispatcher promptly notifies a crisis intervention-trained officer who quickly responds to the call by heading to the scene and, if necessary, requests from dispatch a Trinity Services mental health professional to be sent to the scene. The dispatcher will then contact the on-call Trinity Services mental health professional to begin the process. The mental health professional, upon receiving the call, gathers initial information necessary to respond appropriately. Once on scene, the officer approaches the individual and completes a routine assessment of the situation, establishing a rapport with the individual in need until assistance from Trinity arrives. Upon arrival on scene, the CIT officer typically will brief the Trinity mental health professional of the situation and make an introduction to the individual in crisis. The Trinity mental health professional engages the individual in discussion, assesses for risk of harm, and comes up with options for how the police officer can best resolve the incident while the CIT officer remains with the mental health professional for safety. During this dialogue, the determination would be made by Trinity staff whether or not to suggest further treatment in a hospital setting. In many cases, the mental health professional will be able to assess that there is no immediate risk of harm, and in an attempt to establish a rapport with the individual in need, can offer or arrange for them to engage in beneficial services. This will reduce the number of times individuals are sent to the emergency room for a psychiatric evaluation, and instead steer them towards proper treatment. In this case, the subject demonstrated a risk of harm and a need for inpatient treatment. The mental health professional successfully engaged the individual in crisis, who volunteered to go to the emergency room for a psychiatric evaluation for inpatient treatment. The ambulance arrives on scene for transport to the hospital. Before transport to the emergency room, the mental health professional arranges for continued treatment upon release from the hospital for treatment. The hope is that the person feels more comfortable engaging in treatment sessions with someone they are already familiar with from this experience. The individual enters the ambulance voluntarily and is on his way to further assistance at the hospital. In cases where a petition for involuntary admission is called for, the mental health professional would respond to the emergency room and attend to the matter. This frees up the Orland Park police officer to return to active patrol of the community. The mental health professional meets the individual in crisis at the hospital when they arrived to provide a calming presence to a potentially otherwise anxious situation and to reinforce the relationship that was established on scene. After release from the hospital, the individual arrives to receive the continued treatment that was previously arranged at Trinity Services. Trinity Services will establish a treatment plan to fit the needs of each individual, as determined by the mental health professional. The prior established rapport makes the situation less stressful and provides a familiar and welcoming environment for someone who may need just that at this time in their lives. Trinity Services offers intensive outpatient programs, a counseling center, crisis prevention services, and crisis support teams. Once ready, the individual feels well enough to return to his regular routine. Together, we hope to continue to provide those in need with the services they need with the Mental Health Response Unit. The Orland Park Police Department and Trinity Services are pleased to have found a balance of services that allows for prompt and appropriate care for those in need of mental health services.